what is Space Aging Minnesota? And as you can see on your screen, it is a public information campaign. And what we're trying to do is provoke a compelling conversation that leads to the reawakening and reframing of issues surrounding elder care. And it's those three words, the compelling, reawakening, and reframing. What we found when we first started this campaign is there was a status quo approach to the thinking about issues facing older adults at a time when we are seeing surging demographics and huge strains on services and support, lack of funding mechanisms, and a lot of different items, increased regulations that may or may not be actually helping improve quality of life. So what we wanted to do is start a conversation that would indeed hopefully prompt legislative action, that would increase funding and an embracing of the state's responsibilities to provide those supports. And when you see the words legislative action, sometimes your mind might immediately go to lobbying a specific bill or agenda. And that's not the intention of this campaign. While it's definitely tied into our advocacy efforts that we are conducting here at the state capitol, and truthfully could help some of the advocacy efforts that take place on the federal level, it is more about building a network of people from both inside long-term care services and supports, but outside of our world, and get people moving forward together to ensure that our aging population is able to live their best lives as they age, regardless of where they live, whether that is in a nursing home, a home and community-based service, assisted living, custom living. We really wanted to get people thinking about how they want to age, where they want to age, and what's needed to help them do that. So the challenge that we identified, the challenge that we identified in developing this campaign is basically what we were hearing from our members, what they were experiencing. The aging demographics question, we pretty much all know that there's 60,000 people turning 65 this year, next year, and each year after that for the next 15 years. And these people are living longer and sometimes with more complex acuities. A majority of our population, 85% and older, is going to increase 150% over the next 3 years. And here in Minnesota, by 2020, for I think what could be the first time in state history, we're going to have more seniors than school-age kids. And when you look at those demographics, our members told us quite loud and clear that there's inadequate funding to support the services and supports needed to help them age in place. The age at home, age within our communities. We had years of cuts and freezes to our nursing home funding and to home and community-based services waiver programs. And that really put us at this tipping point where we were seeing increased populations, less funding, and it was starting to have an impact on one of the core elements of what we do, and that's the direct caregiver. The workforce challenges we all face in long-term care is one of our greatest challenges. On any given day, we have over 2,800 open positions in nursing homes. We have high turnover rates, we have high vacancy rates, and we have shrinking applicant pools. We're competing with retail and manufacturing and other industries for the same exact employee. And when we talked with our members, they identified that you bet increased funding would help support increased wages and benefits. But what they started to share more broadly is their general concern with what can be the negative perception around what it means to work in long-term care. The negative words about what a hard job it is, emotionally draining, physically taxing. And they asked us, is there a way that we could look at elevating the profession of caregiving to have a more supportive message over there about the relationship and how it improves quality of life for both the seniors we serve and the people who work in our communities. And generally, coupled with that is this general lack of awareness from people and the services that they'll need. They don't understand what long-term services and supports are, and many of them come into our communities in a time of crisis. And it was interesting, I was speaking with someone from Ecumen recently, and they talked about how you always have these planned moves in your life. You live with your parents, and then you either go to college or get your first apartment, you buy your first house, you upgrade your house when you have a family, you downsize a little bit when your children leave. And all of those moves are looked forward to. They're exciting, and people are planning for them. But really, when it comes to the last move, the where you are going to age and the services you provide, that's met with a sense of dread. So what we wanted to do was take what our providers were experiencing and then compare that with what the public was thinking. So we went out and polled them. About 3 years ago, we did a statewide poll and asked the public questions about long-term care services and support. And what we found was really quite supportive. They do not view this as an entitlement program, and they believe here, at least in the state of Minnesota, that the state should be supporting that and not cut it and not freeze it. However, in our research with them, we also found out the words that jumped out was long-term care is expensive. They questioned the quality. They wondered about whether or not they would be safe and receive quality services in long-term care communities. And there was a general perspective of that this isn't going to happen to me. I'm not going to need this. I'm going to stay at home. I'm going to need this. That's for somebody else. But what we found are personal contacts with them, as well as some interviews that we did with key stakeholders like lawmakers, is that experience trumps knowledge. Those consumers and people who had actually experienced long-term care, whether on their own or on behalf of a loved one, had a better understanding of what it is we do and what support we need to continue to do that. And that's what we wanted to build upon. So when we started to look at the creative execution of the campaign, we started with that core consumer tension. I don't want to think about getting older, and when I do, it scares me. And we started to think about how can we take that tension and convert it. And our strategy was to change the way people see aging. And our initial step was to disrupt, and then build more toward awareness, and then finally toward engagement. So when we were identifying a goal statement, we took our polls, our member feedback, perspective from lawmakers, state regulators, national regulators that we interviewed, and we went into multiple planning sessions trying to summarize this campaign. It wasn't an advocacy campaign designed to pass a bill. It wasn't necessarily a workforce recruitment campaign, and it wasn't particularly promoting a specific line or service that our members offer. What really resonated with us was this general lack of awareness, accuracy, and information on what it means to age well, and how the services and supports that we do help people accomplish that. And there was this old saying that kept coming to mind that if you don't like what's being said, you need to change the conversation. And that's what we're doing. We want to change the way people see aging, from a burden that they manage to a responsibility they embrace. The principle behind the campaign is looking at aging as the third step in a really well-lived life. When we started to look at your life trajectory, you see this emphasis on youth. In fact, we're a culture that's dominated by and fascinated by youth. What are the young doing? How are they thinking? How do I stay young? What does it mean to be young? Is 60 really the new 50? And there's products and creams and services that are all going to help me, preventing us from doing the one thing that we actually are going to do, and that's age. We really don't have any control over aging. And how do we put aging well on par with these other areas of our life, our education years, our jobs and earning years? All of those seem to be high priorities, decision-based, planning for them, but when it comes to aging well, it moves into this negativity. And the timing of this campaign is actually quite good, because what we have been seeing over the past few years is people are actually starting to talk about aging. And by people, I mean media, Hollywood, television. You're starting to see more articles on the independence that seniors desire in aging. You're starting to see the technology advancements that seniors are willing to adopt in order to help them stay at home and age independently. Sometimes all of those images we see further the stereotypes of aging that perhaps we don't like. We're not all going to be Betty White as we age, but the fact that there's this change in the conversation already taking place where the aging demographics are driving marketing. It is a very large population of aging people, and they control a lot of the country's income. So you're going to start to see more attention being paid to aging issues. And we wanted to align ourselves into that dynamic, to be a part of that conversation, to help perhaps tamp down the stereotypes that negatively portray aging and therefore what we do and make it more positive, to put it on par with these other facets of our life. When we started to talk about the campaign, we looked at a couple of approaches, and we had this broad concept that we were just going to go out there and we were going to talk about aging. And trying to speak to 5 million people here in Minnesota and in our surrounding states where this campaign is now reaching really wasn't the best strategy. It's too scattershot. And we do definitely have goals we want to achieve. Our goal is not to defeat ageism, but our goal is to actually build support, more public support, for what we need as long-term services and supports providers in order to support our aging population. So we honed in on a three-pronged approach to help start a new conversation on aging. And the core facts around this was we focused on these three. Inadequate funding, like I talked about, the years of cuts and freezes of government funding on both the state and federal level has really led to an inability to invest in caregivers to help us retain our quality staff. It's hindered investments in technologies that could enhance service deliveries, helping us be more efficient and, more importantly, helping seniors be more independent. It's hindered capital improvements. Perhaps some of our member communities aren't as aesthetically pleasing to the eye. Consumers are definitely, the consumers we're serving, the baby boomers, definitely have expectations. How are we able to invest in our communities to meet those expectations if we don't have the funding source behind that? It's hindering our ability to take more clients who might rely on waivered services. A lot of our members have had to put a limit on that because they can't take more elderly waiver because the funding available doesn't necessarily support the services that are provided. We have members who are suspending admissions because they do not have enough staff to provide the quality of care that they stand by. It really is a question for us of values and what we need in order to meet our missions. And then we looked at the demographics, and this is the middle area. This fast-growing aging population is one that's had the greatest hook when we go out there and pitch stories or talk about this campaign with a wide variety of audiences. We can't slow down aging, and we know the demographics are coming. In fact, they're already here. And with people who are living longer and dealing with complex medical conditions and the rise that we're seeing in dementia. 70% of people aged 65 and older will require some level of long-term services and support. But in Minnesota, when we went out and polled our statewide audience, we found that 52% of them had no plan for how they were going to pay for those services and support. We also started to look at the impact the fast-growing aging population had on our businesses, not just our members, but businesses around. You're going to have a lot of people retiring, and who is going to step in to fill those jobs? What impact is that going to have on the economy, which of course relates back to the funding? And then the services and supports awareness. What are they? I mean, when we talk to people, we still have to further explain what assisted living is and how it's different than a nursing home. When you talk about long-term services and supports, particularly at the state capitol, they all jump and think you're talking about a nursing home. There's really a general misunderstanding amongst some key influential audiences on the work that we do. The home and community-based services that we provide is something that I think is lost on a lot of people. And so we wanted to start raising attention to this services and supports awareness, to move people away from their traditional model of thinking that it was nothing more than a convalescence home or something of that sort. What challenge we faced when we picked these three areas is that if you look at them, each of them in and of themselves could be a crisis. And one commitment we made as part of this campaign is that we didn't want to have a crisis. While I feel this is sometimes a hair on fire moment with what we're trying to do, you can't engage people in your campaign if the only thing you're focusing on is crisis speak. So we paid particular attention that while we had the facts and figures that showed a perhaps negative area in all of these, we turned it around using simple, digestible facts and infographics to start using these as opportunities for how we could invite people into this conversation and advance what we think we need to do to face aging. The campaign, in case, and I don't know if a lot of people know this, but Face Aging Minnesota is actually a collaboration between LeadingAge Minnesota and Care Providers Minnesota. Our organization and care providers are actually partners in something we call the long-term care imperative. And this was formed, I don't know, maybe a decade or so ago. And what it is we are united in our efforts on advocacy. So we work together as partners at the state capitol. We have shared goals and agendas and priorities, and that strength in numbers that we bring to our lobbying efforts and our grassroots advocacy efforts has been very beneficial. But this is the first time that the long-term care imperative, these two organizations, have joined together on a more public campaign. It's really taken us outside of the halls of the state capitol. As our lobbyists have told us, that's not always where the decisions are made, and lawmakers are more influenced by people back home in their districts than sometimes by organizational entities. So we are partnering together on this campaign, and in helping us develop our creative strategy, our brand, we did engage external consultants to do some of that work, including the public opinion poll, and they continue to work with us today. So we're really fortunate to be able to tap into a creative firm that helps us keep this campaign fresh. So the campaign, as I mentioned, has been a multi-year campaign. We initially launched in 2015, and our goal there was awareness. We wanted to insert ourselves, our topics, into daily conversation, starting to put people on notice of the undeniable, unprecedented demographic shift we're experiencing in Minnesota. We spent a lot of time, as I mentioned, crunching data, reworking messages, and identifying channels by which to launch this campaign, because we weren't talking to people in the know. We weren't talking to lawmakers who might have some understanding of how it works. We were really trying to reach out to people and some of those decision makers. So in 2015, we actually did a big kickoff event. We launched with a news conference that had our brand and some of our key information, and started to push out our facts in a new way on the challenges that we face and what we were trying to do to help the state and others get ready to face aging. In 2016, we kept awareness as one of our core messages, and I'll go into some statistics of what we accomplished between 2015 and 2016. But in 2016, we decided that awareness still had to be a part of the campaign, because while we were making strides in getting more people engaged in what we were doing, we weren't necessarily helping move them toward, well, more engagement. They knew what we were doing. They signed up for our email alerts. They were following us on Facebook and Twitter, but they weren't necessarily taking that next step and engaging with people in helping us advance this conversation. So in 2016, we started to bring in some additional elements that would help them advance the conversation. 2017, where we are right now, we are moving away from awareness. We still have it out there because obviously we're in the digital media channels and we're sharing information about the campaign, but now we're really looking at being more of a catalyst for action. How are we moving from our reactionary problem-solving mode to a more sustained solution mode, and how are we bringing in the audience that we have built over the past 2 years to help have them help serve as messengers for what we need to do in order to keep this campaign moving forward. So the key campaign elements that we've used, and as I mentioned, we launched this brand that we're very proud of. It really has resonated. In fact, I know we have had other states contact us asking us for information about the campaign as they're looking to do something similar. We have conducted 2 public opinion polls. The first one was just to identify what the public thinks about long-term care. Our second public opinion poll was last year, and we did that one to see whether or not we were moving the needle. Was our campaign having some success? And the good news was the people that we had polled, a majority of them were familiar with the Face Aging campaign. What we found in that poll, as I mentioned, why we're heading into the catalyst mode, is they didn't quite necessarily know what to do with the information they were getting or how they could take it to the next step. So that has guided us in our 2017 plan. The website of Face Aging, which is www.faceagingmn.org, that has really served as the base and clearinghouse of everything that we do. Our digital marketing campaign is stored there. It's where we drive everyone to for information and resources. We have actually gone through 2 iterations of the website. The first website was probably a little more standard and template. It wasn't eye-catching. It was very heavy on our demographics information and our facts and figures. And when we looked at it with the consumer lens on and we did a focus group, we realized it needed to be more intuitive, it needed to be user-friendly, it needed to bring in more eye-catching colors and images. And so we relaunched the website about a year ago and have had much better traction with it. Social media has been huge for us. Facebook and Twitter have been our two most strategic ways of engaging consumers in what we do. And I should pause there really quick just to talk about our target audience. When we designed this campaign, there was the concept that we should go out and speak to all of Minnesota, and then there was the concept of let's go in after a targeted strategy. So we started to look at who was it that we were trying to reach. And in that, we identified seniors, of course, because they are the ones which we serve. And we wanted to make sure that their voice was represented in this campaign. We are very cautious to not have that paternalistic sort of language where we are taking care of seniors. We don't want to continue that stereotype. We really wanted it to be the relationships and the partnerships that we have together. We also are targeting adult children of seniors, primarily women, as our research has shown that they are the core decision makers often in decisions involving their loved ones. We are also targeting pre-seniors, and those are folks like myself who are between the ages of about 45 to 55 to 60 as part of the preparation model. Are you thinking about this? What should you be thinking about? Is how you want to age going to be available to you when you get there? So that's a core audience for us, and that's actually where we're seeing our most engagement. And then obviously we are also targeting a category we call influencers, and that would be lawmakers. Here on the state level in particular, we've had a very concerted, targeted digital advertising and social media campaign into key legislative districts in order to help us build champions, support our champions, and move people along who might not be in overall support of what we do. We have used digital advertising, as I mentioned, particularly in trying to get some of those messages across. One of the challenges we've had in this, and I think it's something that we all deal with, at LeadingAge Minnesota, I also do our social media, and every day I ask myself, how am I cutting through this clutter? Because there's so much information. And with more people looking at Facebook and Twitter as news sources or other information sources, you just see your feed get filled. I'm sometimes more fascinated by a 30-second cooking video than I might be about a fact and figure that I should be paying attention to. So we are trying to, we struggle, I'll be honest with you, we do struggle with how are we cutting through the clutter and what metrics are we seeing that our messages are getting to where we need to go. We are tracking where our hits to the website are coming from, and we do still find that Facebook is one of our primary sources for that. And when we use images of the seniors or stories of seniors or caregivers, that has really been one of the driving factors of cutting through all that is out there on social media. In our first and second phases, we did paid media. We did both print and radio campaigns. In phase one, our print was primarily focused in the Twin Cities metro area with maybe one ad in the rural area. In the second year of our campaign, we took our paid media strategy, did a few ads in the Star Tribune and the Pioneer Press, but really focused more on regional centers in the state, because that is where we are seeing the biggest growth of the aging population. And we have also had a lot of success at the state capitol in getting rural lawmakers to support our initiatives and our issues. And so we wanted to make sure there was some synergy there. So we did some research with our state demographer to identify what counties in Minnesota have the fastest growing population of seniors. And then we developed targeted advertising using that data in those counties. We also do earned media. That's been a core part of this campaign. We pitch stories a lot. We meet with editorial boards. We really try and get newspaper coverage of what we believe are events that support the messages of face aging. We did 72 lawmaker visits over the course of 4 months, and a lot of those received front page coverage in the rural papers with photos. which then allowed us to cross-promote those. Earned media still is a part of the campaign. In year 3, we are finding that a lot of our pitches are to similar people, so we need to come up with some different stories, and that's why we're pivoting a bit to start talking about caregivers. In phase 2, we did billboards, and you'll see on the right-hand column of this slide, the one in the middle, Face It Minnesota, We're Getting Old, with our website. We ran billboards in, again, those targeted counties along major thoroughfares that had high growth aging populations, and we were able to track some of those metrics. And how billboards go, some of them stay up until someone buys the space. So we initially bought billboards, I think, near Duluth, Minnesota, for a relatively inexpensive price, and it was supposed to run for 1 month, and it ended up staying for 6 months because no one else bought the billboard. So that wasn't bad. We developed a member toolkit, and the toolkit was not designed to promote the campaign, but it was more designed to help members start hosting community conversations, whether on-site in their communities or partnering with organizations to host a community conversation, to invite seniors, their families, and other interested partners in coming to talk about aging. One of the ideas of this campaign is it's not just preparing the seniors for the decision of how they want to age, but it's looking at the community resources that are available to help people age well. Transportation is a huge challenge, particularly in rural Minnesota. We designed our toolkit to maybe start spurring some of those conversations. If you hold a meeting, you could do a whole meeting that talks about the different services that are available. If you need assisted living, home care, or just some level of home and community-based service, does that exist in your community? How does it work? Who pays for it? Do you qualify? So it's designed to have those conversations, again, just to get people thinking. And we could use it as an opportunity to help build a database then of supportive partners, so when we are trying to advance initiatives that secure funding or regulations that help us do our work better, we would tap into that network in order to do that. And that's part of the grassroots advocacy campaign. What we found when we talk about video, in our first videos that we did in 2015, we had 3 or 4 seniors just basically tell their stories of what it was like to age. And one with Helen, who was the original face of Face Aging, really resonated. But as we started to look at video, we wanted to do something different, perhaps a little more thought-provoking, and we looked at a couple of different angles. One of our ideas was to have a young child interview a senior. One idea was to interview a series of seniors and have them do if I knew now, what I wish I had known then, what I'd know now. We thought about doing one where we would ask children to act out what it would look like to be a senior or what they think it means to be a senior, and then have seniors come in and talk to them. We had a lot of different ideas. But what we realized what was missing is the story of what it means for everyone involved in the lives of a senior, the person who is aging, their family members, and more importantly, the caregivers. And we settled in on telling this story of a day and how it impacts everyone involved with someone who is aging. And we really truly believe that this was the story that needs to be told. When we talk to lawmakers, we no longer focus on service lines and data. We really hone in on that personal message of people are aging, the impact it's having on them and their families, and who are these men and women who come to work every day to improve their quality of life. So we wanted the story to be told. And our creative consultant at the time had said to us, sounds like a great story, we'll go out and find some paid actors, write scripts, and we'll make this happen. And we and our partner care providers did not like the idea of paid actors, because something that we pride ourselves on is authenticity. We really believe the messages of the people who live in our communities, who work in our communities, and the families who come and see their loved ones being taken care of have stories to tell. So we went out and tried to find a community that would help us be able to tell the story that we wanted to tell. And this whole project would not have been possible without 4 people, and that is Mary, Moira, Tamika, and Ann Kohler at Serenity Senior Care. It is, we learned a lot in this process, which I'll cover in a second. But what we did is what turned out to be a 2-day video shoot. Now, we did have some scripts that we wrote in advance, and we had some shots that we wanted to get, but we really wanted to showcase each of these people and have them tell their story and weave it together. And the themes of the videos are 3 things, and each of them talks about 3 things of what their lives mean and what they do. And we were very blessed to have met Mary when we did, and we're inspired by her spirit and her story, and we're saddened to hear of her passing just a few months ago, and are so grateful that her family has actually given us the permission to commit to continue promoting these videos, because they believe this story and this conversation is so important that they continue to want to be a part of it. Now, our plan today was to show you these videos, and we're not able to do that. But in the PowerPoint, which maybe can be provided to you, there are live links for you to click on and watch the video. Or if you go to faceagingmn.org, right at the top, I think you'll see Tamika's face, and if you just click there, it'll take you to all 3 videos, and I encourage you to watch them. The lesson that we learned in this process, and this is my huge shout out to Ann, video shoots are a lot of work on everyone's end, but I think we, as the associations involved, underestimated how much work it is for the community and for the person who has to help coordinate this, to get residents present. And when we did this, we wanted to make sure that we showed the broad diversity of services we provide, the community, the residents, and the staff. And it's just, it was an incredible amount of work, and we are so thankful to Serenity, BHS, and Ann Kohler for helping us bring this to fruition. So I encourage you after this webinar to watch these videos. They have had an incredible impact in what we're doing. Our website, this is an example of what it looks like. So you can see it's much more colorful. If you had seen our original one, it was not, so we're very thrilled with that. But now what we have is a website that is seamlessly building out each day. It's completely integrated with our social media and our digital media strategy. Helen, up there on the upper left, the original face of Face Aging, is still actively involved in our campaign. She's actually a blogger now, and she submits, it might be monthly, but we might be slowing down a little bit. So she continues to share her perspective on aging. Through the stories that we're sharing, we are hoping to change the perception of what it means to age in one of our communities, as well as our caregivers. And in 2017, what we heard from members is that they wanted us to start telling more stories about the caregiving profession from the eyes of those who do the work every day. So this year we are indeed weaving that in, and the 3 people that you see on the screen, Mike Mayday, the woman next to caregiving, it's about compassion, and the woman in the lower left corner are all employees at some of our member communities. I think they're in our health support specialist apprenticeship program right now, and we're just starting to tell their stories, why they chose to work in this field, the value that they get from this field, their concerns about what the work means and where it's going, opportunities that they would like to see happen. And we're using these stories, again, to start providing that more personal perspective of what it means to face aging from the eyes of those who work most closely with it. And we are using these caregiver stories actually as part of our legislative strategy this year, as we are trying to move proposals that would provide funding to do a statewide career awareness campaign to help start raising awareness of long-term care careers and our need to fill them. We are looking at innovation grants to launch some new innovative ideas on advancing the profession of caregiving. We are looking for funding to continue our scholarship program for home and community-based services, as well as our nursing facility loan forgiveness program. So these stories are very much tied into our workforce campaign at the legislature. There's also elements on the website, and I won't go out there today, but in addition to sharing the stories and news headlines, you can subscribe for important updates, but we also have readiness quizzes. We link to resources that can help people find out more information about aging. I believe the LeadingAge Minnesota Family Resources page is listed there. The Care Providers Resources page is listed there. Our Senior Linkage Line and Board of Aging are listed there. So we are trying to direct people who might stumble across this and say, but yes, I need more information on a certain community. We're trying to get them routed in a way that would get them that information. We have some clickbait on there as we're trying to drive users. I think we had this tool that you could take a selfie of yourself and then load it into our app and see what you would look like as an 80-year-old, and that actually drew in a younger audience that we hadn't targeted in our strategy. So clickbait, it does work. We also have a heavy, as I mentioned, Facebook and Twitter campaign. These are updated daily, sometimes 4 times a day. What we're really looking for here are stories. We definitely focus stories across the nation, but we would like to be more specific of where our members operate in the communities here in Minnesota and out of state. And what our challenge is sometimes is knowing those stories. When I go out on the road and I give this presentation or I visit a member community to talk a little bit about what they're doing, I walk away inspired because there's so many good stories that are taking place within your member communities, but we don't always know what they are. And with this campaign, the creative consultant that we use is a great staff person named Anna, and she'll give you a call and interview you and write it and send it to you for review, and that's it. That's all. It's not a lot. It's not like the video shoot. This is super easy where you just need to share ideas with us, seniors in your building who might have a story to tell, caregivers who are just doing outstanding work that you feel others could learn from them, activities that you're sponsoring and promoting to help encourage seniors and aging and independence, any of that sort of activity or person we want to fill in our social media. So I just encourage you to share what you're doing here with me at LeadingAge Minnesota so we can continue to use these sites. I won't go out to them today, but if you go to Facebook or Twitter and search Face Aging MN, you'll see these pages and get a feel for what they're doing. For some of our key policy outcomes to date, as I mentioned, this is indeed tied into a larger perspective of getting funding, support, limiting new regulations that hinder our ability to provide quality care, help us increase our workforce. So to date, over the past 2 years here in Minnesota, we did adopt a new value-based reimbursement that is basically covering, more covering the actual cost of care than what we used to. We received an increase in elderly waiver monthly budget caps and took the first step last year toward the more comprehensive reform we're seeking this year. This year we're looking at about a near $100 million investment in our waiver programs. Workforce has been a huge topic at our state capitol, I know across the nation, so we are indeed seeking increased funding, have received increased funding for both of the programs listed, but this year we're really focused on getting grant funding from our, I think it's the Department of Trade and Economic Development here in Minnesota to help us support a career awareness campaign, something that we have seen have great success in the manufacturing industry here in the state, and we're hoping to parallel some of those efforts to better support our members. But I think one of the biggest accomplishments we've had to date, which isn't necessarily tied to funding or policy, is being able to secure aging committees in both bodies of our legislature. This has given us a platform each and every week to talk about our members, what they do, challenges we face, and opportunities we would like to take advantage of. It has helped us build stronger legislative champions. It has helped us educate lawmakers and the public. It has helped us advance our initiatives. It has engaged people more in this topic. It shows how cross-cutting it is. We often think of aging as a health and human services issue, but it's really not. It really extends into a variety of facets of what our states do, from transportation services, education, higher education, and this opportunity to have weekly meetings in both bodies of our Minnesota House and Senate has given us an opportunity to showcase the incredible work that our members do, as well as build support for helping them address their champions. So some of our key member outcomes to date, now this is just LeadingAge Minnesota data, but what we have done through Face Aging is actually used it as a tool to better engage our members in advocacy. And I think one of our greatest outcomes is we've changed how we ourselves talk. We don't use crisis language. We don't talk about things like it's a white paper or statutes and rules. We really use common everyday language to talk about our challenges. And we have resulted in sending 15,000 emails to lawmakers, 10,000 postcards. We had 300 people show up at regional town forums we held around the state. We've done 100+ legislator site visits to date, and we have more planned for this month. And we have on average about 130 of our members attend our annual day at the Capitol, which is coming up on March 30th. So there's been just this really good engagement from our members in the language that we're using as part of Face Aging, which has since translated into a stronger grassroots advocacy. And all of this work is noted, and we use the regional town hall forums and the site visits and our day at the Capitol to do media stories around that. And again, those media stories talk not only about our challenges, but they expose people a little bit more to what we do. Some of our consumer outcomes, now this is Face Aging data. We have over 1,000 Face Aging Minnesota email subscribers, and we shoot emails out to them. We typically would do it weekly. Right now, I think we're doing a little bit of every other week. And what I mentioned is we're moving now, rather than just a, hey, visit our website, we have a new story to tell, but we're starting to work on what do we want them to do. Because that's what we're hearing from consumers. Love your campaign. I agree. We need to do this. What can I do to help? And that's what we're meeting on now internally here, is how do we take this consumer awareness and interest and turn it into engagement. We have I think we're close to 5,700 now on Facebook. We have about 840 followers on the Twitter, and our videos continue to get views. The Serenity Marion videos, particularly Mary's story, and most importantly Tamika's story, those just jumped. We launched those the week of Thanksgiving and tied it into a Be Thankful campaign, and they outpaced all the other videos that we've done. We went a little bit quiet when we learned about Mary's passing. We took the videos down, but now that the family has given us permission to repost those videos, we will be doing some targeted pushing around those again. So where is this campaign going? We're moving away from disruption. We do think we have people's attention. We have generated the awareness, but now we're moving more toward what some folks call the transformation stage. I like to think of it as engagement, because I'm not really sure what we're transforming, but we are definitely engaging people. We are trying to get folks to prioritize aging well from a legislative perspective and their own lives perspective. And we need to look at this as a mandate. This isn't a one and done issue. It's going to evolve and change over time, as we do, as our members do. You evolve and change how you offer services, how you market services, how you secure staff to deliver those services. This campaign has to move along with that, and I think that's where the idea of transformation comes in. We're going to continue to transform in order to see that broad accountability from all folks involved in order to make aging a priority. What we did not anticipate but are super excited about is Face Aging has actually spurred action and what are similar parallel efforts here in the state. So our Citizens League and Twin Cities Public Television are currently launching a program called Calling Home, and if you are a TPT viewer, perhaps you've seen the spots. I think they have information on their website too, but what they're doing is they're traveling the state holding intergenerational conversations about what home means and what people want in their homes and how they have to plan for when their life changes are inevitable and what is going to be required to help meet those expectations of consumers. That is currently underway. We're meeting with them on Friday to start talking about building out their campaign. Rethink Long-Term Care campaign is a new initiative. It's being designed to better prepare Minnesota and its health systems. It's very, I would say it's probably more clinical service delivery focused on the needs of its aging citizens. There's a bill at our Capitol to help fund this campaign, but regardless of the funding, this has a lot of support and could be going forward. And then we recently learned that our own Minnesota Board on Aging is thinking about launching a similar public information campaign to Face Aging that includes a component on how to engage lawmakers and our gubernatorial candidates. We have an election in 2018. When we hear about these similar initiatives, we get super excited because we think we're gaining traction and we've raised awareness. But we also have a concern that they seem perhaps duplicative or repetitive. And we need people, we need a lot of people, because it's going to take a lot of us working together to accomplish this goal of changing the conversation and better preparing our state for how we can face aging. But we need to make sure that we're not stepping all over each other. And I think we have a retreat that we do every summer on the imperative, and this is going to be a topic for that. Where does Face Aging go? We have 2 or 3 more years of strategy in mind, but what are these efforts doing? What direction are they going? Where's the synergy for perhaps a better alignment? And we all have finite resources. How do we best maximize those resources? So it'll be interesting to see how each of us evolve and where we might intersect and actually collaborate. But it's great news because prior to Face Aging, none of this work was going on. And we feel definitely that we were a part of sparking a conversation to spur this action. So our future direction right now, we are focused on completing our reform agenda, which is the items I just covered. We are really focusing on increasing consumer engagement. We have people, now we need networks. and we have to move them to taking action. And they're asking us, what is it you want us to do? Where can I help? Or here's what I'm interested in. And we're looking at what platforms, what organizations can we partner with to keep this momentum going. So people are out there on our behalf talking about what they expect and what they need, and that can then help support what we do. And we are talking about, we believe we want to elect a face-aging Minnesota governor. By no means does that mean it's a logo and it's an endorsement, but we want seniors and their care, the services that they need, to be a center point, a centerpiece of our upcoming gubernatorial election. Every candidate who's running for governor, we want them to be a champion for long-term services and support. That is who dictates what is going to happen over the years that they're in office. And we are not partisan. We're not interested in who is governor. We just want a governor that's going to make seniors and caregivers and long-term care their priority in the next administration. So where we see marketing alignment and how we've been talking about it with our members since the beginning is we have really built a broad digital audience focused on those adult children of seniors, influencers, and the media. And we think that, as I said, if you have stories to tell, if you like what we're saying, the more we could share that and integrate it into our digital social media strategy, the better. We run a very active balance campaign. It's a lot of human interest stories and a lot of testimonials. You will not see partisan commentary. We don't delve into partisan commentary, so it really is a broad public campaign, very balanced in its messaging, and we are adding additional online resources, conversation starters, and other general information to help keep the public informed. Where we think we can help together is to like our Facebook page, the Twitter page, to encourage staff and residents and families to like and tweet and repost and share what they see on the face-aging pages, to provide comments supporting the great care and work that people do, to share. I am desperately seeking more positive stories of great caregivers, great programs, activities that you do, particularly activities that are intergenerational or broader, and invite more of your community partners in. So please share those with me, because we want to profile them and we are hungry for content. And then tag Face Aging MN in your own social media posts. Those are some of the ways that I think we can continue to build momentum for this campaign and really help educating the public on what we do. And that was a long 52 minutes of listening to me talk. So that is the information that I was just thrilled to share with you today, and I'd be happy to take any questions in our remaining time.
Jodi?
Yes.
Oh, okay, sorry, I didn't know if I was still on mute. What's the best way for us to get those stories to you? Would you like us to email them to you directly, or is there someone else we should send those to?
No, email them to me directly. At the last slide, there is my email and my office phone number, but just email them to me directly, and just a brief summary of the story. And like I said, we meet weekly as an editorial team to talk about stories, and I just want to keep funneling them to folks. And I know BHS has sites outside of state, and I know this campaign is called Face Aging Minnesota, but we'll take stories from anywhere that our members are doing great work.
And can you tell us a little bit about the member toolkits and the Talk About Aging conversations that you're encouraging?
Yeah, the member toolkits went out. I'm trying to think. It's been a while now. But what there was in there was that it was basically a toolkit that would help you host a meeting. So it had sample posters. It had conversation starters where you could put together small groups to talk about services and supports, how people want to age. It had flyers that you could distribute to people after that meeting. It really was designed to just help you host a meeting or a conversation, and you could pick, I think there were 3 or 4 suggested topics. One was about services that you might need to help you age well. One was about what thought have you given where you want to age. It had a focus, I think, on independent senior living and assisted living, for example. The How Helping You Age Well, I think, was more focused on some of the home and community-based services that our members provide. So they were basically Q&A documents and conversation starters, and then it had a sample of who from your community might you want to invite to that conversation. Oh, I think there was one that was encouraging members to even hold like cross-cutting meetings with higher education, the chamber, and others to encourage those conversations. One of my greatest challenges. The toolkits are developed. You know what I will do? I will check to see if they're still on our website as downloadable. I'll check that first, and then we can send that link around. And if not, I can see about how we could. It was all available electronically as well. So if it's not on our website, I can get that and send that around to everyone. Or I can send that to Carolyn, and she can send it around to everyone.
That'd be great. And it looks like we have a couple of questions in chat. Phyllis Kramer, and she's asked, is this campaign being done in Illinois and throughout the Midwest?
Not yet. So far, it is indeed focused on Minnesota, but like I said, I think the elements of the campaign could definitely be used in the community, and we would welcome those stories. We have had other states, I know California, for one, has contacted us about interest in it, but it is not right now outside of, our work has not extended outside of the borders. But we do definitely want stories from all of our member communities, regardless of what state you're in. One of the ideas I like about this campaign is if we can just share those positive stories. I'm tired of only getting calls from media on negative. So we really want to spread that more positive story.
And then we have a question from Mary Wallen. And Mary, maybe you could clarify a little bit. You had, were these sent to administrators or to marketing? And I'm not sure exactly what you were talking about there.
If she's talking about the toolkits, it was sent to administrators.
Oh, okay.
And gotcha. That is a lesson learned right there. I'll make a note of that.
Other questions today? All right, well, we'll wrap it up then. Thank you so much, Jodi. That was a wonderful presentation, and I think there's a lot of great information that we'll be able to use moving forward. And also, you know, keep us posted as to how we can help you with your efforts.
Most definitely. Thank you so much, everyone, for taking the time today. And again, if you have any questions, my contact information is at the end of the PowerPoint, and I'm happy to talk.
Thank you again.